Hello, my name is Benedetta Belleridder. I work in the Department of Control of Neglected Tropical Diseases at the World Health Organization. It is my pleasure to introduce you to this course on One Health and Action Against Neglected Tropical Diseases. In this course, we will explore how to apply a One Health approach to neglected tropical diseases, the NTDs. Through 6 modules, we will learn about NTDs and why a One Health approach is key to addressing them, how we can start adopting a One Health approach, how we can work together in an efficient way, how we can work with local communities, and how we can unlock political will to drive sustainable impact. At the end of this course, you will be able to put One Health into action. We will give you examples of how to build the confidence you need to start doing One Health, find priority health issues and common goals, overcome siloed approaches to foster intersectoral collaboration, identify new players or new relationships among existing stakeholders, work with local communities from the very beginning, break down power imbalances in decision-making, advocate for a One Health approach to NTDs at all levels of government, demonstrate success to ensure long-term political engagement and funding. Taking the One Health approach requires a paradigm shift. And this, of course, requires time and effort. But we know it's feasible. It's important to start now, start anywhere. The One Health approach, of course, does not only apply to the neglected tropical diseases, so the principles mentioned have a broader application. Let's start the first module of the course, titled An Introduction to One Health and Neglected Tropical Diseases. NTDs cause hardship to the world's poorest populations, and this happens for several reasons. Let's see what they are. These diseases have been known for centuries, but still, they often remain overlooked. Worldwide, they affect 1 billion people, mainly in tropical and subtropical areas, and they prevail in economically, socially, and geographically marginalized communities. Not only do they affect people in their bodies, but they also inflict a disproportionate economic and psychological burden and suffering at the individual and community level. They increase inequality and vulnerability, which are already high in these settings, and this worsens food insecurity in people and their livestock, and limits the livelihood of communities, triggering migration and the abandonment of agriculture. In 2021, the World Health Organization published this document titled Ending the Neglect to Attain the Sustainable Development Goals, a roadmap for neglected tropical diseases 2021-2030, commonly called the roadmap. The roadmap aims at reducing the burden of 20 diseases and disease groups that, as you can see in this map, mainly affect Africa, Asia, and Central and South America. Each of these 20 diseases and disease groups is targeted for either eradication, elimination as a public health problem, or control by 2030. Each of them poses its own specific challenge, but many of them also have something important in common. They have a strong animal and environmental component. This means that they are not only a human health problem, but they also involve the health of animals and the environment as part of the problem, but also the solution. For this reason, the roadmap advocates for cross-cutting approaches that can provide larger benefits, broader than human health itself. This can be done by developing national operational One Health plans or by integrating NTDs into existing health platforms. Or we can do it by improving our understanding of the human-animal environmental transmission of NTDs, or by considering opportunities for joint intervention across program planning, advocacy, implementation, surveillance, and evaluation. Let's see the practical example here. We adopt a cross-cutting approach when we create laboratories where the infrastructure and resources, for example, sample collection, logistics facilities, staff, reagents, microscopes, and so on, are shared to expand and strengthen surveillance for humans, animals, and the environment at the same time. In this slide, I mentioned One Health, but what does One Health actually mean? The One Health high-level expert panel defines One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment are closely linked and interdependent. The approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and the ecosystem, while addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. This is the definition that WHO, with its partners, the Food and Agriculture Organization of the United Nations, the World Organization of Animal Health, and the United Nations Environmental Programme have endorsed. A One Health approach acts at the interface of human, animal, and environmental health. Let's take dengue and rabies as examples to bring the approach to life. With dengue, we see the extensive urbanization expands mosquito habitats, and this leads to the sustained proliferation and the endemic transmission of vector-borne diseases. Here, the health of humans and the environment are interlinked. As far as rabies is concerned, we know that 99% of human rabies cases are transmitted through dog bites. So preventing the disease in dogs through mass dog vaccination is key to preventing it in people, because mass dog vaccination stops transmission between dogs and from dogs to people. Here, the health of people, dogs, and other animals, pets, livestock or wildlife, who may catch rabies from dogs and further spread it are connected. One Health approaches that recognize the relationship between health and our environment are particularly important as our environments continue to change and evolve. We know that this will have an impact on our health and on the health of animals and ecosystems, but we don't know the extent of this impact yet. Some studies are investigating this. Let's look at the impact of environmental changes on disease risk for a few NTDs. There are a few examples here, but let's focus on dengue and chikungunya. These diseases are transmitted by mosquitoes, and two environmental factors, temperature and rainfall, favor them. When the temperature increases, mosquitoes breed at a faster rate and their biting frequency increases too. When it rains more, the range of wet habitats for mosquitoes increases. This can also happen when it rains less, as when people store water during droughts, they create more wet places for mosquitoes to breed. When both temperature and rainfall increase, there's more humidity, so there are more favorable periods during the year for mosquitoes to develop into biting adults. Because of this, and considering the rising temperatures worldwide, as well as the changes in rainfall trends, we can expect the risk for dengue and chikungunya to increase where these diseases are already prevalent. So in the tropics and subtropics, but we also expect it to move to new geographical areas, such as temperate areas in Southern Europe and high altitude areas in Nepal, and to become an issue in new periods of the year, such as winter months in Bangladesh. Adopting a One Health approach brings several benefits for NTDs and beyond. For example, financial resources can be allocated in a more cost-effective way. Duplication of effort can be reduced while resources are maximized. Unintended negative consequences can be avoided. Results can be delivered in a sustainable way, and in general, health systems can be strengthened. Let's see each of these benefits in detail in the following slides. We said that through One Health, financial resources can be allocated more cost effectively. Rabies control is a great example for this. Vaccinating dogs is the most sustainable way to prevent rabies in people. And vaccinating dogs is also cheaper than providing people with treatment after they are exposed. When we look at how different rabies endemic regions fund rabies control, we can see that many countries spend most of their money on post-exposure prophylaxis for people and relatively little on dog vaccination. South American countries take a different approach. Compared to Asian countries, they spend more on dog vaccination, and this results in more human deaths being prevented compared to Asia, despite a similar overall spending. Taking a One Health approach can also help reduce duplication of efforts and make the most of resources such as infrastructure or workforce. Let's see what was done for nomadic pastoralist communities in Chad. Reaching these communities is challenging because they're often on the move and they live in very remote areas. Traditionally, the vaccination of livestock and the vaccination of children against childhood diseases was done separately. So each community had to be reached twice. Then they combined into a One Health program. This was facilitated by the fact that in pastoral and rural communities, animals are a source of wealth and are usually highly valued for cultural and religious reasons. The new integrated program not only involved the vaccination uptake and coverage in children, but also reduced the costs of human and animal vaccination by 15% because it allowed the sharing of logistics like personnel, transport, and cold chain between physicians and veterinarians. Taking a One Health approach can also help avoid unexpected consequences. Let's take as an example the control of schistosomiasis, which is a disease that is transmitted via freshwater snails and affects both humans and bovines. If we adopted an old-fashioned siloed approach for the control of snail populations, we would use chemical control, but this can harm non-target species of wildlife and can cause devastation to the water ecosystem. If we use a One Health approach, we can apply biological control by using natural predators that eat snails, and we can clear the freshwater vegetation to reduce snail habitats. This One Health approach easily appears as to the to-go solution if we don't look at schistosomiasis only as a human and bovine health issue, but if we also consider its linkages with food safety, because people consume fish, and water, sanitation, and hygiene, or WASH as we call it, because people use water to water the animals and wash their clothes. A systems thinking approach is an approach to problem solving that use problems like schistosomiasis as part of a wider system. So it demands a deeper understanding of linkages, relationships, interactions, and behaviors among the elements that characterize the entire system. As a result, it allows the balance of risks and opportunities for all the elements in the system. One Health is a way to put the system thinking approach into practice. When we adopt One Health, we can deliver results in a more sustainable way. For an example, on a plantation in Papua New Guinea, conditions were optimal for snake populations to explode, and approximately 10% of workers were being bitten by snakes each year. This was successfully reduced by an integrated intervention. First, workers were provided personal protective equipment, such as gumboots to prevent bites and high visibility vests to easily locate them if they were bitten. Then, local healthcare workers were trained in snakebite management to increase the delivery of fast and efficient life-saving treatment after bite. The plantation also needed to address the environment and increase the width of pathways to make it easier for workers to see snakes and prevent snake bites. They also reduced the population of non-native rodents because they had become a major food source for snakes. This integrated approach helped them sustainably tackle snake bite and reduce the number of workers being affected. Finally, One Health strengthens health systems overall, beyond neglected tropical diseases. Let's see two examples. In Pakistan, teams initially trained in participatory disease surveillance for rinderpets were then redeployed for other disease programs and for support during emergencies like earthquakes and droughts. In Brazil, veterinarians from multidisciplinary unified health system teams were redeployed during COVID-19 to support food safety campaigns, train health workers, and conduct COVID-19 testing and surveillance. When we build workforce capability in different sectors, we can break down organizational silos across disciplines. We improve transdisciplinary ways of working. We expand and strengthen One Health networks and collaboration. We allowed skilled personnel to be shared or redeployed in times of high need, such as during a pandemic, and we overcome critical skills shortages, which are common in the impoverished areas where NTDs are endemic. Building a strong yet flexible workforce capability is only one of the ways by which health systems are strengthened. You will encounter other examples along the course. We have understood that One Health is beneficial in many ways, but still motivating different sectors to work together can be challenging. One of the most common reasons is that a disease that would greatly benefit from the One Health approach is not considered a priority for all sectors. So why should they participate? Cystic echinococosis is such a disease. This disease has two animal hosts, dogs and sheep, and it eventually affects humans. For each of these three species, primary and secondary prevention measures are available. We can deworm dogs, and we can prevent them from feeding on infected offal. Additionally, we can control the population of free-roaming dogs. With sheep, we can vaccinate them. With humans, no primary prevention measure is there, but it's useful to wash hands after handling dogs and avoid food or water that can be contaminated by dog feces. Now that we have seen what can be done, let's see what sector is actually interested in doing it. In dogs, which in endemic countries have a minimal economic value compared to livestock, and in sheep, whose production is not particularly affected by cystic echinococosis, priority is actually low. On the contrary, priority is high with regard to human health, because this disease can be a serious public health problem. An interest misaligned is clearly there. Understanding objectives from the whole system is therefore important to help identify common ground for different sectors to collaborate in the control of this disease and drive shared outcomes. One Health involves a range of sectors, even beyond the ones related to health that you might traditionally think of. Here, for example, we have education, tourism, and industry. These sectors are likely to have different objectives, but they can come together to achieve shared outcomes, such as having stable, safe, healthy, and productive communities, ensuring animal welfare, safe food production, and protected wildlife, making sure that environments remain healthy and resilient to change, and delivering services that are accessible, affordable, inclusive, and meet community needs. This ultimately supports the achievement of a better and more sustainable future for all. This is the ultimate goal of the Sustainable Development Goals. In this module, you learned that the disproportionate burden of NTDs on poor populations can be reduced by 2030. The health of humans, animals, and the environment is interdependent. One Health is a systems thinking approach that unifies efforts across sectors, disciplines, and communities to optimize the health of people, animals, and ecosystems in a fast-changing environment. One Health is key to working in a cost-effective way, maximizing resources, avoiding unintended consequences, delivering sustainable results, and strengthening health systems. One Health is about understanding systematic interventions and incentivizing collaboration towards shared objectives. As we finish this module, let's take a moment to reflect. In what ways is a One Health approach appropriate and beneficial to your context? Here are the links to the documents and research papers on the topics covered by this module. This slide provides you with additional resources, including other OpenWHO courses that you may be interested in. In the next module of the course, we will focus on One Health actions needed to address neglected tropical diseases. I thank you for your attention.